In this version of Global Health Insights, I'd like to speak about our paper published in The Lancet that is a systematic analysis of all the available studies about protection that is derived from previous infection with COVID. The good news is that we find even at 10 months, the protection against severe disease and death, regardless of the variant that you were infected with, appears to be 90%. So that's excellent, sustained protection. The second observation from the analysis is that the protection from past infection against being infected, but not severe disease, is not as impressive. At 10 months, that looks to be, for the Omicron variant, maybe as low as 36%. So there's a difference in the protection for what really matters, severe disease and death, much higher, much more sustained than being able to block transmission through immunity from past infection. Another observation from our analysis is that there's very many fewer studies on the protection that an Omicron infection gives you against future subvariants of Omicron. For example, a BA1 infection against BA5 or BA4, that appears to perhaps be even a little bit lower, but there isn't that many studies. The fourth major observation from this analysis, and perhaps a surprise to many, is that the protection from past infection is at least as good as, or in many cases, more sustained than from 2 doses of an mRNA vaccine or 2 doses of any of the other vaccines that are out on the market. This does not mean that you should not get vaccinated, because vaccination is the safest way to get immunity as compared to getting infected with COVID. The vaccine, even though Omicron and the sublineages that are around for Omicron are much less severe, as we've seen in China or in Hong Kong, if you have not been infected and not ever been vaccinated, then Omicron can certainly kill. And so you do want to maintain immunity, if you can, through keeping boosters up. And that's particularly important for those that are 60 and above, or those that have major comorbidities. We think that the evidence of sustained protection from past infection means that restrictions on access to activities or entrance to the United States or other countries on the basis of vaccine status should be modified to take into account past infection, particularly if that past infection has been in the last 6 to 10 months. As we look ahead to thinking about managing immunity, because immunity does appear to last at least 10 months, we do agree with the suggestion that annual COVID boosters are probably appropriate, particularly for those at high risk, because we don't yet know how long immunity from past infection will continue past 10 months. But as data accumulates, that basic notion that you get sustained protection at least for 10 months, we may end up extending that farther out. Why does past infection seem to give sustained immunity? Well, it not only has, by being exposed to the actual COVID virus, do we not only see different types of antibody responses, but we also think there's probably a strong T-cell response to past infection that helps in that sustained protection. All of this means that we really need to be more concerned in the future about the possibility of a new variant with immune escape and is more severe than Omicron, than being particularly concerned about ongoing waves of Omicron sublineages in those that have had a past infection or who are vaccinated or both. For those who are not vaccinated and have never been infected, you remain at high risk, and it's important to try to seek out vaccination so that you move into that category of most of the world that have protection against severe disease, either through past infection or vaccination.